Hi friends, in this topic of general examination, today I will talk about Pallor. First is the disclaimer. Caring Dogs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only and it should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention, and treatment of medical illnesses. There is no endorsement for any brand or company. Pallor is paleness of the skin and the mucous membrane. The sites where we see the pallor are conjunctiva, tongue, oral mucosa, palmar crease, and nail beds also gets paled when HB is less than 8 gram per deciliter. Pallor can be graded based on its visibility. Mild pallor is when it cannot be detected clinically. Moderate pallor is when it is clinically visible. And severe pallor is when it is clinically visible plus one of the following feature is also seen. Palmar creases, they disappear, and we can also hear the cervical venous hum. When the cervical venous hum is present, it is suggestive of chronic compensation. How do we elicit the cervical venous hum? We have to auscultate the root of the neck on the right side with the bell of the stethoscope with the patient in standing or sitting position. A continuous murmur will be heard. The cervical venous hum, it was first described by Pontaine, so it is also called Pontaine's murmur. The presence of cervical venous hum indicate chronic compensated severe anemia. There are various other medical conditions which show pallor without anemia, and these are hypopituitarism, hypothyroidism, hypogonadism, and shock, especially when there is left heart failure. Coming to anemia, I have a special video on anemia also. Anemia, it is defined as decrease in circulating red blood cell, and it is characterized by decrease of hemoglobin concentration or RBC count or hematocrit. Hematocrit is also called packed cell volume. When it is below normal for patient's age, sex, and altitude of the residence, we call it as a anemia. Normal adult hemoglobin is 13 to 17 gram per deciliter in males and 12 to 15 gram per deciliter in females. There are certain clues which help in determining the type of anemia. For example, in iron deficiency anemia, there are certain specific symptoms which can help us uh, to detect whether it is iron deficiency anemia or, or etiology is different. For example, if the patient has pica, pica is eating non-nutritive substances like dirt, paper, clay, chalk, dysphagia, difficulty in swallowing, restless leg syndrome, melena, that is black tarry stools. Black tarry stool indicates GI bleeding. When these symptoms like pica, dysphagia, restless syndrome, melena, when these are present, they are likely suggestive of iron deficiency anemia. Certain specific signs like ball tongue, Koilonychia, blue sclera, peripheral smear suggestive of microcytic hypochromic red blood cells. All these suggest iron deficiency anemia. In iron deficiency anemia, other investigation which we can carry are bone marrow, iron studies, stool occult blood, endoscopy, ferritin, serum ferritin, and iron profile. Coming to megaloblastic anemia, the features which symptoms which are suggestive of megaloblastic anemia are tingling and numbness in the extremities, sensory ataxia, that is loss of coordination, glossitis, knuckles, hyperpigmentation, absent deep tendon reflexes, sensory loss, positive Romberg's test. All these signs are suggestive of megaloblastic anemia. In peripheral smear, we will get macrocytic RBCs, hypersegmented neutrophils, pancytopenia, and other specific investigation. They can be carried out as vitamin B12 and folate level, which will be low, bone marrow examination, Schilling test. A Schilling test is done to assess vitamin B12 absorption. Third is the anemia of chronic disease. The anemia of chronic disease, the symptoms will be related to that chronic disease like kidney disease, liver disease, or other connective tissue disorders. The specific signs are patient may have hypertension or arteriovenous fistula, as in chronic venous disease, chronic kidney disease. Signs of liver disease like ascites, jaundice, signs of rheumatoid arthritis, SLE. Peripheral smear will be normocytic, normochromic in type, and other specific investigation like RFT, LFT, autoantibodies, raised serum ferritin levels can also be done or can be found. Fourth is hemolytic anemia, and the specific symptoms which will suggest to hemolytic anemia are whether when there is family history of anemia, patient has history of gallstone or splenectomy. Specific signs will be triad of anemia, jaundice, and splenomegaly. Hemolytic facies like frontal bossing, chipmunk facing, chipmunk faces, frontal bossing, depressed nasal bridge, maxillary hypertrophy, malocclusion of teeth, short stature, leg ulcers, especially in severe cases. All these specific signs they suggest about the hemolytic anemia. The peripheral blood smear will show microcytic hypochromic cells, as in thalassemia. Microspherocytes. Microspherocytes are also seen in hereditary spherocytosis, sickle cell disease, sickling of the cells. Patient will show reticulocytosis in peripheral blood smear or hemogram. The HB electrophoresis can help us in detecting various hemoglobinopathies, for example, to differentiate it from thalassemia or sickle cell disease. Coombs test can help in detecting autoimmune hemolytic anemia. Sickling test to confirm the sickle cell disease. Osmotic fragility test helps to diagnose hereditary spherocytosis. Coming to aplastic anemia, the specific symptoms will suggest about the recurrent infections due to lack of white blood cells, especially the neutrophils. Patient will have neutropenia. Patient will have bleeding manifestation which are caused by thrombocytopenia. The specific signs because of pancytopenia, patient will have all the three cell lines reduced. Though there will be no organomegaly, it will help us in differentiating aplastic anemia from other types of anemia. The peripheral blood smear will show pancytopenia. Bone marrow examination is a definitive test and it will be hypocellular in aplastic anemia. The various cytogenetic studies they help in detecting any chromosomal abnormality that may suggest a specific cause of aplasia. Patch Adam has said the purpose of a doctor or any human in general should not be simply delay the death of the patient but to increase the quality of life. With this, I conclude my today's topic. Thank you. Keep learning.